Thank you all for joining us today. We'll be having a guest speaker, Dr. Gerald Acloque. He's a primary care physician. He has a lot of knowledge to give, so I really hope you guys listen closely and get your questions ready because we'll have a little Q&A session at the end. I'll go ahead and hand it over to you, Dr. Acloque.
Good evening, everybody. My name is Dr. Gerald Acloque, Jr. Feel free to call me Dr. G. I know it's difficult to say my last name, and I've heard it all, so it doesn't hurt my feelings. But first, I wanted to say I'm humbled to have been invited to speak to you this evening. It's always an honor and privilege to speak to our young kings and queens who are in the height of their most important years of their lives. And as I know, these interactions, however small, have the potential to have a big impact on the path of all their futures. So I do not take it lightly. So I want to thank Fredeline and your advisors for this amazing opportunity to speak to you. And unfortunately, the topic of discussion is extremely boring because it's about me, right? But and I'm sorry about that. I tried to get them to change it, but apparently those in charge of the program seem to think there is something to gain by hearing about my story. So let's get to it, right? I was born in Jersey, Newark, New Jersey, rough neighborhood, at a rough time in the early 80s. And my parents saw it, fit to move the whole family down to South Florida when I was just at the tender age of 9. And even then, I knew I wanted to be a doctor. I had no idea how. Had no other doctors in my family at the time. They told me stories about my great-grandfather in Haiti, who was a pharmacist and a doctor and gave away all his medications and was a terrible businessman, but a great doctor. Didn't know him. But finally, at some point in my, I guess just about graduating from college at Florida A&M University in Tallahassee, I finally found a mentor. My uncle, he married into the family. Not my blood uncle. He married my aunt, and he was on his way in internal medicine at the time, becoming a cardiologist in Puerto Rico, Mayagüez, beautiful town on the west side of the island. And he was Superman to me, literally. He pulled himself up by his bootstraps from Haiti, went to Mexico and did medical school there. And ended up being a cardiologist. He is now one of the preeminent electrophysiologists in the state of Florida, and I would say in the Southeast. And he is the director of the lab at the trauma center in Daytona. And yeah, so this man was very important in my life. So tracking on after I finished off at Florida A&M. He is the one who said, hey, why don't you just go to Mexico and get into medical school there? He's having a tough time getting into medical school here. So I did that. I followed his advice. After FAMU, went to Guadalajara, Mexico. All I knew was hola and adios at the time. So you can imagine how the intrepidation, the fear that built up inside of me when I was, to leave the comforts of the US and get a passport for the very first time and go to Mexico to stay there by myself for 4 years to learn medicine and apparently learn Spanish at the same time. Believe it or not, I learned Spanish in 8 months, and I was fluent. It's what happens when you get thrown into the fire. You learn immediately. And yeah, got through medical school, made great friends, that I still, follow and we stay together today. We still communicate, and ended up, oddly enough, in Ponce, Puerto Rico, for internal medicine. The road to Ponce, Puerto Rico was a bit winding as well. Hard to get into internal medicine residency. They're very competitive, and to be honest with you, I wasn't the best student. Never have been the best student, but I am the most committed, and I am absolutely the most hardworking. No one's going to work harder than me. and I have to be that way, right? If I'm not the smartest, gotta work the hardest. And it's always been that way for me. Made my path a little bit more difficult, but we made it through nonetheless. So graduated from Ponce, from the program is called Damas Hospital in Ponce, Puerto Rico. It's on the south side of the island. Beautiful island. If you ever get a chance, please go. And yeah, we left there and came back to the United States. Brought my family back, and we decided that, you know, to come back to South Florida. Skip back a little bit in the middle of my journey in between medical school and in residency. My sister passed away, which was a big blow to me, to my whole family. She was the light of my life. She was the apple of my eye. She was the life of the party. She was the go, right? But that was something that tested my tested. It's what I'm saying is you're going to be tested along the way wherever you're going. My test was a little bit bigger than maybe others, and others have bigger tests than myself. Not to compare, but that was my test on whether or not I was going to continue on my path, and I decided to persevere. So fast forward again, back to South Florida, and went back and worked and triumphed, and now we have a fledgling practice in South Florida and Hollywood, Florida. We are thriving. The business is doing well. I have a family that's doing well. Things are going very well. At this point, I have the ability to do what I promised myself I would do, as part of the way I got through the tragedy, and start to give back. And I've been giving back as much as I can when I can. One of the things we did this past year is begin an endowment at this, at the Florida State University, in the School of Interdisciplinary Medical Sciences, and we endowed a scholarship for young minority women, that we are going to continue to grow. It started around, I think I believe we're 50,000, and we're going to continue to grow that. And my goal is to get that to 500,000. And Miss Frederline is one of our inaugural winners, and I'm so proud of her. Super proud of her. She is she stands out along with the other two winners, and I applaud her. And I know she's going to continue to do well. So that's a quick 50,000 view, 50,000 foot view of my journey. But my story is not uncommon, not at all. And I'm sure that many parts sound a lot like your story, right? And I believe in our community. I believe in our community, the underserved, the minority community in general. We don't talk about these wins and losses enough. Meaning we're not mentoring enough. We're not reaching back enough to set tangible examples of, which is very unfortunate, because these examples are what our young kings and queens need to thrive. Need to see what it is to actually, get set back and what it is to win, in order to continue to win. And I feel there's many reasons for that, but that's a conversation for another day. What I do hope that you take away from my story and is an important message from my story. And so allow me to break it down simply for you, like I do a lot of the concepts in medicine, makes it easier to understand and palatable, like in biochem and pharmacology. Don't like those. But the first concept, in my opinion, there are three things that drive achievement, right? Your talent, your effort, and your commitment, right? And for the short term success in any of those two of those three attributes, it'll be okay. You'll do all right if you have two of the three. But for long-term success, you need to have two specific qualities for sure for long-term success, and that's effort and commitment. You don't have to be the most talented to achieve your goals, but you will have to go give maximum effort and commit yourself completely and go all in for your success to stand the test of time, right? And there will absolutely be things that will test you and test both of those qualities in you, like my own personal tragedies. But it's those individuals that persevere through these tests that will taste real long-term and long-standing success, right? And the second concept is fear. And fear is a healthy, basic human emotion. It can do two things for you or to you. The first is a good and healthy thing, and that is fear can help keep you alive when a potentially dangerous situation arises, right? And the second is it causes us to pause from whatever we are doing. Whatever you're doing, if you fear, it will cause you to stop for a second, right? The problem is when that pause becomes a paralysis, keeping you from your maximum achievement. So this paralysis by fear comes about by being present with a situation where the outcome is unknown. You're presented with a situation that you don't know what's going to happen on the other side. So meaning you lack knowledge concerning whatever it is that you're confronted, and you're confronted with that and simply don't know, cannot make a decision at all. So the key here is when you sense fear, never ignore it. Never ignore fear. Lean into it. So you know where it's coming from, what type of fear it is, right? If it's danger, move away, right? If it's dangerous to you, move away. But if it's lack of knowledge that you have that's causing you that fear, lean into it. Learn more about it. And once you understand it, make a decision. Either remove yourself from that fear or continue on your path to winning, right? So that's basically the story. That's basically my story, right? Those are the things that drive me to continue to succeed and to continue to reach my goals. And those are the basic things that I would like for you to take home and keep in your back pocket, right? So the quote, our artist Issa Rae, I root for everybody Black and our allies. That's who I root for, you know? That's who you should root for. Root for yourself, bet on yourself, and you're going to reach your goals. So I thank you for your attention today. And again, I greatly appreciate the opportunity. I don't want to keep you long, but I would love to answer all of your questions.
If you guys have any questions, go ahead and write it in the chat box.
Ferdelina, am I going to see these questions, or are you just going to read them out?
I'm going to read them out.
Okay.
For you. Our first one, we can get started with, why did you choose primary care?
Why did I choose primary care? Because primary care offers me the opportunity to have, I believe, the greatest effect on a patient's, on all patients that I see in the long term, right? I think that I feel that other specialties see people when whatever it is too far gone, right? Surgeons see people when they're already, they need something taken out or they need something. Nephrologists see patients when their kidneys are bad. Cardiologists usually see patients when their heart has already failed or it's already had a heart attack. For me, I think I can effectuate the most change and help more people to prevent all of these things from happening if I can, right? And then help people understand, to remove that fear with knowledge, to help people understand what diabetes is and how to manage it, what heart failure is and how to manage it, what high blood pressure is and how to manage it. So it gave me the opportunity to touch more people before they got sick. And I wholly believe in preventive medicine. That's why I chose internal medicine. Thank you for that question as well.
And we have a follow-up, and it's, when and how did you know you specifically wanted to be a doctor, or more specifically, a primary care physician? Like, when did you? What was the big moment?
I'm gonna date myself here. There was a show when I was a kid. It's called Doogie Howser, MD. Yeah, Miss Trill knows what I'm talking about. When I was a kid, Doogie Howser was the man. He was the more polite, version and younger version of Dr. House, basically. Super intelligent, and just knew all the, well, he figured things out. And I thought that, hey, you know, that job is amazing. I want to do that. I want to be able to figure out what's wrong with people. I want to help people. I wanted to be a genius, but I'm not. But that part missed me. But you know, the rest that's when, and that happened. I would say I was about, I don't know, 8 or 9 years old, maybe a little bit older, 10. When I decided that, hey, you know what, this is the path I'm going to take. Again, had no idea how I was going to do it. Didn't have a mentor in front of me to show me, and that's why I'm committed to doing what I'm doing now, and to be a mentor to help other, you know, younger, the people who are going to take care of me when I get older. I want to make sure they're there. So, yeah, that's what I decided.
And we have another question, and it is, what would be your biggest piece of advice to students at the beginning of the journey, like, you know, high school students and, you know, students just entering college who want to pursue a medical career?
Find a mentor. Find someone in the field. Doesn't have to be the exact field. If you don't know at that age, you don't know if you want to be an internist or a surgeon or a nephrologist or a pathologist, you don't know, but just find someone in that field. Someone who has traveled the journey that you want to travel. You ever try to go from your house to, I don't know, a brand new mall that just opened up, new highways, new byways, they cleared out trees, I don't know, someplace you've never been before. Now we have these computers in our pocket, and we can just, you know, punch up the address and figure it out. But when I was younger, we had maps, right? You need a map. You need someone to tell you, hey, you need to turn here. It's better if you can go that way. It's another way to get there, but this is better, right? Do this, do that. Prepare yourself this way to get there. You're gonna need, you know, to carry some food with you. It's a couple of days, right? It's a drive from New York, from Miami to New York, right? It's gonna take you a while. Find a mentor, please.
Thank you for that. We have another question, and it is, as a primary care physician, what happens on a day-to-day basis for you?
Wow. I am a unique primary care physician. Our practice in South Florida is called Florida Concierge Medicine and Wellness. We opened it with the concept. We started it with concept where it is all cash based, and no insurance. And the reason for that was to offer everyone in the community an opportunity to have access to medical care. We've now grown large enough where we have that base, and we're now introducing some select insurances. So my day, and then I also have an aesthetics portion of my practice. So I get to do some hands-on procedures because I love to do procedures. And I can do that as an internist. I'm trained to do small procedures in the office. I also do medical research. I'm heavily involved in medical research. We did a lot of research in COVID. So a day for me, walk into the office, check my calendar. I see patients usually in the morning. I usually have, after lunch, I will do some procedures. We have lasers in our office. We have injectables in our office. I do Botox in my office. Later on the afternoon, I don't go to the hospital, but I do round in my research clinics. I do 2 different research clinics in Miami. So yeah, in the afternoon, I go see that you're not called patients in research, they're called subjects, but I follow up on that and do the paperwork for that. So this is a function of my ADD, right? I need this type of input to keep me focused. I need to change up. That doesn't mean that's the way you need to practice your medicine, but that's the best way for me. It keeps me engaged. And then I do a lot of community outreach, usually after work, like I'm doing now, trying to. But yeah, I like to do after hours things before going home when I can, if my wife lets me. Go out and get community outreach and go to after hours things and meet people and get monies donated into these endowments and other things that we do.
That's amazing. So you kind of have like a foot and a leg in so many different things.
Yeah, I
Yeah.
do. I do.
Okay, so another question is, if a student knows they want to be a doctor but are not sure what kind, what can they do in high school or beginning college to help them decide?
Volunteer. Volunteer
Mhm.
your time at a hospital facility, volunteer your time at a doctor's office if you can. That and you're going to be able to do that with the facilitation of your mentor, right? We all have friends in different branches of medicine that we can, hey, pull a favor here or there. Hey, could you, take this young lady or young man under your wing for a day, let them see what you do, and maybe you'll like it. You don't have to commit from the very beginning. You don't have to commit even in medical school. You can go through, you want to do medicine, you're going in that general direction. And when you get to medical school, you'll have some more exposure to more doctors, and there you would, better decide. Even if let's say you wanted to be a cardiologist, the way medical school, way residency works, you still have to do an internal medicine, 4 years of internal medicine first, and that goes for cardiologists, that goes for oncologists, that goes for nephrologists, that goes for many, well, except for radiology, but most of the different branches go that way. The ones that don't diverge a little bit are radiology and cardiology, maybe pathology and ophthalmology, right? But all the rest basically come from a background of internal medicine, and then you do a fellowship of 3 years. So you still have more time, is what I'm saying. Um, you don't have to decide immediately. It's not something that you have to do today. You just have to have the commitment and the effort forward to know that you're going that direction. Because the more commitment and effort you put in now, the more attractive you will be as a candidate towards the end, so you can, reach your ultimate goal.
All right. And another question is about how long were you in school?
Forever. I was in school forever. Okay, let's add it up. 4 years of at school, well, not counting high school, right? Not counting high school. So we're gonna go to 4 years of undergrad, 4 years of medical school. And then I technically count residency as school. Other people like to count it as work. I count it as school. A part of my story that I left out just for the sake of time, um, I actually did a pre-internship, two pre-internships before I got into residency, because it was just so competitive and it was hard for me to get in. And one of the friendships, one of the friendships that I made back in Guadalajara actually helped me get into residency eventually in Ponce. And that's just the way things work, right? You form these relationships, you're good to people and people are good to you. You just have to have the faith that that's going to happen. So you're good to people, not with any thinking that you're going to get anything in return. And lo and behold, 3 years later, this person put in a good word with me with the program director and got me into residency. So I did a transitional year on top of that. So you count the 4, and then 4, that's 8, plus a transitional year and the pre-residency. My road actually took about 14 years. Eesh.
Wow, yes. Spend most of our lives in school.
Absolutely. And you know what? It never stops, Ferdelane. We're
Hmm.
always in school. I'm here. I'm in Beverly Hills tonight. My very first time. Never been here before. But I flew this morning. And I'm here on a convention to learn about lasers and other stuff that you have to continue to learn. You have to continue to learn, or else you will die on the vine, especially with medicine.
Absolutely. We have another question, and it is, can you explain what internal medicine is versus what primary care medicine is?
Same, interchangeable.
Hmm.
Internal medicine is the practice. It's the old school name of of what we do. Your regular doctor that your mom and dad goes to, you get your yearly checkups. When you guys get sick, a pediatrician is basically an internal medicine or primary care doctor for kids. Um, An internist is a primary care doctor. Primary care means first, right? Primary first care. And that's what I was saying, that's why I like it, because I get to see things first. And I have the responsibility to be vigilant and also try to control things before they get out of hand. Hopefully I treat them. Hopefully I help you prevent these things before it's out of control, right? So primary care and internal medicine are the same. It's a big umbrella. Obviously, cardiology fits, again, like I said, the fellowship of cardiology fits under internal medicine, but it's just a branch. It's internal medicine directed only at the heart or the cardiovascular disease. Nephrology is internal medicine, just directed strictly at the nephrons, at the kidney, and so on and so forth. GI, gastroenterology, is tucked under internal medicine. GI from your mouth to the exit, right? So that's what they do. So yeah, those are all pieces of internal medicine, but primary care proper would be your general doctor who your mom and dad or adults see yearly or biannually, depending on how bad or what's going on with them. So what I like to say is we know a little bit about everything, and the other specialists know a lot about a little.
Another question is, if you could choose one mistake that you could go back and change and do it differently, what would it be?
That is an excellent question.
Mm-hmm. So basically, if you could do anything different, what would it be?
Yeah,
and what would you do?
But the wording is amazing, right? The wording is amazing. If I had one thing to do over, I would spend more time with my family. All the other mistakes are, so be it, right? I would definitely share more time with my sister, knowing now what happened. I would share more time with my parents now that they're older. I would share more time with my grandfather, both of my grandfathers who passed away, and grandmothers. I would share more time with your family. Learn more about your family history, learn more about them, quiz them, question them. There's so much knowledge in there that you don't have to go searching in a book, and they love you to death and they'll give it to you. They won't make you work for it, right? Definitely, I would share more time. I would spend more time with my family, and I do that now. Now that I've turned that around. I spend a lot more time with my friends and family than goofing off doing other things and doing things that I don't need to be doing. Shopping and playing games and all that other stuff. I spend more time with my family.
That's wonderful. The next question is, what aspects of practicing medicine do you find the most challenging?
Getting people, the most challenging part is getting people to understand the implications of what they're doing to themselves in the long term, and understanding that I do not have the ultimate say so if they're going to do it or not. It's hard, right? We go to school for 14 years, and we learn all this stuff, and we think that we're just going to come out of medical school or residency and we're just going to go and everyone is just going to listen to me and do what I say, and it's going to be great, and I'm going to save every single person. That's not the way it is, right? So that's very hard for me to accept that people have free will. I picked up this mantra that I like to say, especially when I get pushback from patients. I say, hey, I am a waiter, a very, very good waiter at a very fine restaurant. I know everything on the menu, and I know everything that's good for you. My job is to present to you the menu. Your job is to select what you want and take what you don't and leave what you don't. And I feel so much better with that type of approach. And it works, actually. It actually works. More people actually say, hey, you know what? He's not pushing it on me. He's just telling me what's on the menu and what's good for me. There are things on here that I'm allergic to. He won't give me those. I can choose them if I want and try to take them, but he's not going to give me those. He's going to give me what's good for me. He took his time to learn, took these years to took his time to, and his time away from his family to learn. And he's offering me these good options. I trust him, and I'm going to select, and I'm going to choose to trust him and see how it goes. So that approach has actually worked a lot for me.
That's actually really amazing. A lot of times you will get a lot of struggle and pushback from patients, and it can get very frustrating.
Absolutely.
Mhm. We have another question, and it is, can you tell us about a time where you had to deliver some bad news to a patient?
Wow, I don't know if I can choose just one.
Mhm.
Unfortunately, the job comes with lots of good news, but some very tough news we have to give. Just recently, I met a very nice couple from Canada, and middle age, I guess late 50s. Met them just doing a regular pre-op clearance to clear them for cataract surgery. And we became, I became their doctor from in the U.S. that while they're snowbirding here. And eventually, the husband texted me on a weekend and said, "Hey, wife has abdominal pain." Long story short, I ended up having a bad hunch about this pain, and we found pancreatic cancer, which was terrible. It's terrible, I've done this countless times now, having to give bad news that people are going to pass away, or they have an illness that's untreatable. But the pit in my stomach, I get it still. And I got it with delivering that bad news. But I will say this: when you deliver bad news, it's jarring to you the very first time you do it. Clearly, maybe the first 10 times, but it's best to be honest. And I'm not rude. I'm not, I make it clear as to what is happening and be honest with folks, and they appreciate that. They appreciate that. I don't hide anything from them. I give them my honest medical opinion as to what, the prognosis, meaning what the probability that it's going to happen in the next 5, 10, 15 years or months, days sometimes. But yeah, so be honest if you ever have to give anyone, and that's just good practice in general, right? Hey mom, I broke your lamp. Hard to do, right? Easy to say. The concept is easy. So you want to, it's delivering bad news about something you did or something that it's best to be as honest and as straightforward as possible. Try not to leave anything out knowingly, and you will do well. And people appreciate that, even in their toughest of times.
Yeah, I think that may be one of the worst parts of the job, honestly.
Absolutely.
Another question is, what was the last stressful situation you encountered in your job, and how did you react?
That's,
Was
that's a daily thing, right?
Yeah.
The last stressful thing I encountered. Geez. Yeah, it's just it's the little things. Sometimes the computer won't work, or sometimes the labs won't come in on time, or sometimes tech won't work, the phone doesn't work. I was driving and my phone power went out. It's just the little things. There's not much. Well, there are things about the job that you will find very stressful, directly related to the job, and I will say the biggest thing is how it's the way we do it here in the United States. It can be very stressful. There's a lot of paperwork. There's a lot of red tape. There are people who do not have any specific direct knowledge medical knowledge who make very, very, very important decisions. You will oftentimes not agree with those decisions that are being made, be it in Washington, D.C., or in the administration of your hospital. Sometimes these folks just don't have any understanding of how impactful their decisions are on you personally as a doctor, and then on, well, in the scope, bigger scope, on your patients because of what the decision they made. So I think that probably the job itself is how things are. Rarely do we get good news from administration or the U.S. government about how we're going to do or things, and in insurance companies as well. Rarely do they say, "Hey, you can have anything you want." No, it's not the way it works. So yeah, so having to deal with that is quite stressful.
And we have one more question before we wrap up for the night. What are some qualities or characteristics that students should try to develop the most in the stage that they are in now that'll 100% help them in their medical career?
I already told you to, right? You can't really force yourself to be the most talented, smartest person in the world, right? Your ability to your talent level is sometimes innate. You can grow it, you can improve your talent, so that's one thing. But you can absolutely, positively make a better way by improving your effort and your commitment, right? And what are you going to push that effort and commitment to? That's the key. You can push effort and commitment in many ways, but if you want to be successful, effort and commitment towards study habits, very important, right? Study habits. If you don't have good study habits from the very beginning, it's going to make the road infinitely harder when you get to subject matter that is super dense and you don't have a basis to understand the concepts that you're being taught or being asked to memorize or being asked to understand and be able to put into practice. So effort and commitment towards your craft every single day. Michael Jordan didn't become Michael Jordan overnight, right? He was famously cut from his JV basketball team, right? I don't know if LeBron James was ever cut anywhere because the guy is just like superhuman, but he also has effort and commitment towards his craft. Kobe Bryant, effort and commitment, tenacity, bar none. Like no one else was going to outwork him. And plus he had talent, a rare breed. He had all three, right? So you can control the two. So control them and put them where you need the most, where you're going to get the most return on your investment. And that means hit the books and hit them hard. Find a mentor that can show you the way, and spend time with your family.
Thank you so much, Dr. How do you pronounce your last name again?
Acloque, like a cloak and dagger.
Acloque. Acloque. I kept pronouncing it like Acloque.
I've heard it all before. Heard it all before. Call me Dr. G. It's fine.
Thank you so much. We really appreciate you coming out and taking the time, especially on a busy night like you have tonight in Beverly Hills. We very much appreciate you, and I'm sure everyone here on this meeting took something away from you.
I appreciate it. I really do. I really do appreciate. I'm humbled that you asked me to do this. When we met, I told you I would. And again, I find it to be very important for us to pour into the young doctors, young scientists that are coming behind me, because the future is it needs to be cultivated. We need to pour into everyone else who has, all these young folks who have a dream to become a doctor or to become a technician or become a radiologist, whatever it is that you want to do in science, whatever it is you want to do in life. You deserve to have someone pour into you knowledge and guidance, so that way you can get to where you need to be. Thank you.
Yes. Thank you. Ms. Jody, do you have anything you would want to say? No? Okay. Well, thank you again for coming. I hope you all have a really great night. Yeah, that's it. We're gonna go ahead and end this meeting.
Thank you. Good night, everybody.
Good night, everyone.